Ladies and gentlemen, welcome to my channel. Today we want to share information about cancer and prevention methods with you. Now let's start.
The primary contributors to lung cancer are cigarette smoking, exposure to second-hand smoke, and occupational exposure to carcinogens like asbestos and radon. Additionally, air pollution and genetic factors can also play a role in increasing the risk of developing lung cancer. Preventing lung cancer primarily involves avoiding tobacco smoke. Additionally, minimizing exposure to environmental carcinogens like asbestos, radon, and air pollutants can reduce risk. Maintaining a healthy lifestyle with regular exercise, a balanced diet rich in fruits and vegetables, and avoiding exposure to harmful chemicals or toxins can also help lower the risk of developing lung cancer. The main causes of colon cancer include a combination of genetic factors, lifestyle choices, and environmental influences. These can include a family history of the disease, a diet high in red or processed meats, low intake of fruits and vegetables, lack of physical activity, obesity, smoking, heavy alcohol consumption, and certain medical conditions like inflammatory bowel disease. Preventive measures for colon cancer include regular screening tests such as colonoscopy, maintaining a healthy diet high in fiber and low in red and processed meats, staying physically active, limiting alcohol consumption, avoiding smoking, and maintaining a healthy weight. It's also important to be aware of any family history of colon cancer and discuss screening options with a healthcare professional. Breast cancer can be caused by a combination of genetic, hormonal, and environmental factors. Specific causes include inherited gene mutations, hormonal factors like early menstruation or late menopause, dense breast tissue, a personal history of breast cancer or certain non-cancerous breast diseases, radiation exposure, obesity, excessive alcohol consumption, and lack of physical activity. However, it's important to note that not all individuals with these risk factors will develop breast cancer, and some individuals without these risk factors may still develop the disease. Preventive measures for breast cancer include maintaining a healthy lifestyle by exercising regularly, maintaining a healthy weight, limiting alcohol consumption, avoiding tobacco, and eating a balanced diet rich in fruits, vegetables, and whole grains. Bladder cancer typically develops when cells in the bladder mutate and grow uncontrollably. While the exact cause of these mutations is often unknown, several risk factors have been identified that can increase the likelihood of developing bladder cancer. 1. Tobacco use. 2. Exposure to certain chemicals. 3. Age. The risk of bladder cancer increases with age, with most cases diagnosed in people over the age of 55. 4. Gender. Bladder cancer is more common in men than in women, although the gender gap is narrowing. 5. Race and ethnicity. Caucasians have a high risk of developing bladder cancer compared to African Americans and Hispanics. However, African Americans tend to have a higher mortality rate from the disease. 6. Chronic bladder inflammation. 7. Family history. Preventing bladder cancer involves reducing exposure to known risk factors and adopting a healthy lifestyle. Here are some strategies for bladder cancer prevention. 1. Quit smoking. 2. Limit exposure to harmful chemicals. 3. Stay hydrated. Drinking plenty of fluids, particularly water, can help dilute urine and reduce the concentration of potential carcinogens in the bladder. 4. Maintain a healthy diet. Some studies suggest that certain foods, such as cruciferous vegetables, e.g., broccoli, cabbage, and foods high in antioxidants, may have protective effects against bladder cancer. 5. Limit exposure to radiation. 6. Practice good hygiene. Maintain good urinary tract hygiene to reduce the risk of urinary tract infections, which can increase the risk of bladder cancer. 7. Regular medical checkups. 8. Consider genetic counseling. Liver cancer can arise from various factors, including 1. Chronic viral hepatitis. Chronic infection with hepatitis B virus, HBV, or hepatitis C virus, HCV, increases the risk of liver cancer. 2. Cirrhosis. Cirrhosis, which is scarring of the liver tissue, often caused by long-term alcohol abuse, chronic viral hepatitis, or other liver diseases, can lead to liver cancer. 3. Non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. Accumulation of fat in the liver, often associated with obesity, diabetes, and metabolic syndrome, can progress to inflammation and cirrhosis, increasing the risk of liver cancer. 4. Exposure to aflatoxins. Aflatoxins are toxic substances produced by molds found on certain foods, such as grains and nuts, particularly in warm and humid climates. 5. Alcohol consumption. 6. Inherited liver diseases. Preventing liver cancer involves maintaining a healthy lifestyle, including 1. Limiting alcohol consumption. 2. Avoiding hepatitis infection. Vaccination against hepatitis B, practicing safe sex, and avoiding sharing needles can help prevent hepatitis infection. 3. Maintaining a healthy weight. 4. Eating a balanced diet. 5. Limiting exposure to toxins. 6. Regular medical checkups. Thyroid cancer typically develops when cells in the thyroid gland mutate and grow uncontrollably. While the exact cause of these mutations is often unknown, several factors can increase the risk of thyroid cancer. 1. Radiation exposure. Exposure to high levels of radiation, particularly during childhood, increases the risk of thyroid cancer. 2. Genetic factors. 3. Gender and age. Thyroid cancer is more common in women than in men, and the risk increases with age, particularly after age 40. 4. Iodine deficiency or excess. 5. Certain benign thyroid conditions. Some benign thyroid conditions, such as goiter or thyroid nodules, may increase the risk of thyroid cancer, particularly if they are large or rapidly growing. 6. Family history. Preventing thyroid cancer can be challenging because many risk factors, such as genetic predisposition and environmental factors, are not easily modifiable. However, there are some steps individuals can take to potentially reduce their risk. 1. Limiting radiation exposure. 2. Maintaining a healthy lifestyle. Eating a balanced diet rich in fruits, vegetables, and whole grains, and maintaining a healthy weight can support overall health and may potentially reduce the risk of certain cancers, including thyroid cancer. 3. Regular medical checkups. 4. Avoiding tobacco. 5. Monitoring thyroid health. 6. Genetic counseling. Stomach cancer, also known as gastric cancer, can have various causes, including 1. Helicobacter pylori infection. This bacterium is a common cause of stomach ulcers and is also a significant risk factor for stomach cancer. 2. Dietary factors. Consuming a diet high in salty, smoked, or pickled foods, as well as low intake of fruits and vegetables, may increase the risk. 3. Smoking. Tobacco use is linked to an increased risk of stomach cancer. 4. Family history. Having a close relative who has had stomach cancer increases the risk. 5. Certain medical conditions. Conditions such as chronic gastritis, pernicious anemia, and stomach polyps can increase the risk. 6. Age and gender. Stomach cancer is more common in older adults and is more prevalent in men than in women. Preventing stomach cancer involves several strategies, including 1. Healthy diet. Consuming a diet rich in fruits, vegetables, and whole grains while limiting processed meats, salty and smoked foods, and pickled foods can lower the risk. 2. Avoiding tobacco. 3. Limiting alcohol. 4. Treating H. pylori infection. 5. Maintaining a healthy weight. 6. Regular medical checkups. 7. Limiting exposure to certain chemicals. 8. Managing other medical conditions. Prostate cancer is typically caused by a combination of genetic, environmental, and lifestyle factors. Age, family history, race, and diet are all known to play roles. Additionally, exposure to certain chemicals or toxins may increase risk. Preventing prostate cancer involves a combination of lifestyle changes and regular screenings. Maintaining a healthy weight, staying physically active, and eating a balanced diet rich in fruits, vegetables, and whole grains can lower the risk. Limiting intake of red meat and processed foods, as well as avoiding tobacco and excessive alcohol consumption, is also beneficial. Cervical cancer is primarily caused by persistent infection with high-risk types of the human papillomavirus, HPV. Other factors that can increase the risk of cervical cancer include 1. Smoking. 2. Weakened immune system. 3. Sexual behavior. Early onset of sexual activity, having multiple sexual partners, and engaging in unprotected sex can increase the risk of HPV infection, which is the primary cause of cervical cancer. 4. Family history. 5. Long-term use of oral contraceptives. Preventing cervical cancer primarily involves 1. HPV vaccination. 2. Regular screenings. 3. Safe sexual practices. 4. Smoking cessation. 5. Healthy lifestyle. 6. Health education. Non-Hodgkin's lymphoma is a type of cancer that originates in the lymphatic system, which is part of the body's immune system. 1. The exact cause of non-Hodgkin's lymphoma is often unknown, but several factors have been identified that may increase the risk of developing the disease. 1. Weakened immune system. Conditions or treatments that weaken the immune system, such as HIV/AIDS, organ transplantation, or certain medications used to treat autoimmune diseases, may increase the risk of non-Hodgkin's lymphoma. 2. Age. The risk of NHL increases with age, with most cases diagnosed in people over 60 years old. 3. Viral infections. 4. Exposure to certain chemicals. 5. Autoimmune diseases. 6. Family history. 7. Previous cancer treatment. Preventing non-Hodgkin's lymphoma, NHL, can be challenging because the exact cause of the disease is often unknown. However, there are some steps individuals can take to potentially reduce their risk. 1. Maintain a healthy lifestyle. 2. Limit exposure to chemicals. 3. Protect the immune system. 4. Avoid viral infections. 5. Quit smoking.